In 1987, while most people were watching Wall Street crash on Black Monday, a Filipino immigrant nurse in Houston was making a bet that would change her life forever. With nothing but her nursing credentials, her savings, and an unshakable belief that she could build something from nothing, she walked away from the security of a hospital paycheck and launched a business in one of the most competitive healthcare markets in America. Today, nearly 4 decades later, her company stands as one of the largest privately owned nursing agencies in Houston, serving the world's largest medical center and employing hundreds of healthcare professionals. Her name is Helen Dichoso, and her story is one that most people have never heard. She arrived in Texas during a pivotal era in American healthcare, when Filipino nurses were flooding into the United States to fill desperate staffing shortages. But while thousands of her compatriots were content to work the grueling hospital shifts, collect their paychecks, and send money back home, Helen saw something different. She saw an opportunity. She saw a gap in the market, and she had the audacity to fill it. What makes her story even more remarkable is the world she conquered. The Texas Medical Center isn't just any healthcare district. It's the largest medical complex on the planet, home to over 60 institutions, 21 hospitals, and more than 100,000 employees. It performs a surgery every 3 minutes. It delivers a baby every 20 minutes. And at the heart of this medical metropolis, one Filipino woman built a staffing empire that major hospitals came to depend on. This is the story of how a nurse from a small town in the Philippines transformed herself into an award-winning entrepreneur, a pioneer who broke barriers in a male-dominated business world, and a matriarch whose legacy now extends through generations of healthcare professionals. From ICU bedside to boardroom, from immigrant to industry leader, this is the incredible journey of the Filipino nurse who built a healthcare empire in Texas. Stick around until the end, because the full scope of what she accomplished and what it means for the Filipino nursing community is truly extraordinary. To understand Helen Dichoso's extraordinary rise, you first need to understand the world she came from and the forces that brought her to Texas. Here's a fact that might surprise you. Filipinos make up just 1% of the American population, but they account for 4% of all registered nurses in the United States. That's not a coincidence. It's the result of a hidden history that stretches back over a century. When America colonized the Philippines in 1898, they didn't just bring soldiers. They brought an entire education system, including nursing schools built on American curriculum and taught in English. For nearly 50 years, the Philippines was essentially training nurses to American standards without most Americans even realizing it. Then came 1965. The Immigration and Nationality Act opened the doors for skilled workers, and Filipino nurses flooded in. By the late 1960s, Filipino applicants made up 80% of the exchange visitor program. Hospitals in New York, California, and Texas were desperate for staff, and these nurses were perfectly prepared. They spoke English. They knew American medical procedures. They were ready to work. Over 150,000 Filipino nurses have immigrated to the United States since 1960. The Philippines became the world's leading exporter of nurses, and America became their top destination. Texas emerged as one of the major hubs. According to the Texas Nurses Association, over 56% of all foreign-educated nurses working in the state come from the Philippines. That's not a small number. That's a workforce that keeps Texas hospitals running. But here's what most people miss about this story. The standard narrative says these nurses came to America, worked hard, sent money home, and lived quiet lives. And that's true for many. But a select few saw something different. They looked at the healthcare system they were serving and spotted the gaps, the inefficiencies, the opportunities. While their colleagues clocked in and clocked out, these visionaries started asking a dangerous question. What if I built something of my own? Research by Dr. Jennifer Nazarino at Brown University has documented this hidden phenomenon. In her groundbreaking dissertation, she identified 50 Filipino women who owned healthcare businesses in Southern California alone. 50. And that's just one region. These women built home healthcare agencies, nursing homes, and assisted living facilities. They created what Nazareno calls an ethnic economy. Nurses sharing resources, helping each other build businesses, lifting their communities while building wealth for their families. This wasn't charity. This was capitalism. Filipino nurses recognized that the same skills that made them excellent caregivers also made them excellent business owners. They understood patient needs. They knew hospital operations from the inside. And they had networks of fellow nurses they could recruit and trust. The story of Filipino nurses in America isn't just about sacrifice and service. It's about entrepreneurship hiding in plain sight. It's about a workforce that changed American healthcare while simultaneously building an invisible empire of small businesses. And nowhere was the opportunity greater than in Houston, Texas. Because Houston wasn't just another city with a few hospitals. Houston was home to something unprecedented. A medical complex so massive, so concentrated, so hungry for nursing talent that it would become the perfect launching pad for the most ambitious Filipino nurse entrepreneurs. The Texas Medical Center was calling, and one woman from a small town in the Philippines was about to answer. August 1987. While Wall Street was headed toward Black Monday and the rest of America was watching the stock market wobble, Helen Dichoso was making the biggest bet of her life. She was walking away from the security of a hospital nursing job to launch her own company. No venture capital, no business degree, no safety net. Just a Filipino immigrant nurse with a vision and the courage to chase it. She called it Allied Health Services. And from day one, she knew exactly what she was doing. See, Helen wasn't some outsider guessing at what hospitals needed. She had lived it. She had worked the overnight shifts in the ICU. She had seen the chaos when a nurse called in sick and there was no one to cover. She understood the desperation hospital administrators felt when their critical care units were short-staffed and patients' lives hung in the balance. This wasn't theoretical knowledge. This was battlefield experience. Her initial focus was laser sharp. Specialty ICU nurses for the critical care units at major hospitals in the Houston Medical Center. That's it. She wasn't trying to be everything to everyone. She was trying to be the absolute best at one thing. When hospitals needed elite intensive care nurses on short notice, Helen Dichoso was the person they called. Think about the audacity of this move. This was 1987. There was no internet, no LinkedIn, no online job boards. Building a staffing agency meant pounding the pavement, making phone calls, and convincing hospital administrators to trust you with their most critical staffing needs. And Helen wasn't just competing against other small agencies. She was competing against large corporations with established reputations and deep pockets. But she had something they didn't. She had credibility. She was a nurse talking to nurses. She understood the work because she had done the work. And in an industry built on trust, that mattered more than any marketing budget. The gamble paid off. Hospitals started calling back. Contracts started flowing in. And by 1988, just 1 year after launch, Helen was ready to expand. She added pre-operative nursing, then operating room specialists, post-anesthesia care unit nurses, medical surgical staff, telemetry experts, emergency room professionals. Each new specialty represented a calculated bet that Helen could deliver the same quality across a broader range of services. But she didn't stop with registered nurses. She brought on licensed vocational nurses, certified nursing assistants, and scrub technicians for operating rooms. She added private duty care services for patients who needed support at home. Every expansion was strategic. Every move was designed to make Allied Health Services indispensable to the hospitals it served. The company grew from a single specialty into a comprehensive healthcare staffing solution. From one woman with a phone to a network of professionals serving hospitals, clinics, and outpatient surgical centers across the greater Houston metropolitan area. And here's what set Helen apart from competitors who cut corners. Quality was non-negotiable. She would later achieve the Joint Commission certification for staffing agencies, one of the most rigorous quality standards in the industry. When you hired from Allied Health Services, you knew you were getting professionals who met the highest qualifications. In just a few years, Helen had transformed from bedside nurse to business owner to industry player. But the recognition she truly deserved was still coming, and when it arrived, it would cement her legacy as one of the most remarkable healthcare entrepreneurs Houston had ever seen. When Ernst & Young hands you an award, people pay attention. This isn't some local business association plaque. Ernst & Young is one of the Big Four accounting firms, a global giant that has recognized everyone from Jeff Bezos to the founders of Google. Their Entrepreneur of the Year program is legendary, and Helen Dichoso won it. The health category. A Filipino immigrant nurse from a small town in the Philippines standing alongside the titans of American business. But that was just the beginning. The Small Business Administration came calling next. The SBA Entrepreneurial Success of the Year Award. This is federal government recognition, an acknowledgement that Helen had built something exceptional, not just by immigrant standards or women's standards, but by any standard. The agency that supports millions of American small businesses looked at what Helen had created and said, "This is what success looks like." Then came the Cora Bacon Foster Award, Women Business Owner of the Year, from the Greater Houston chapter of the National Association of Women Business Owners. In a city with thousands of female entrepreneurs, Helen rose to the top. Houston is the fourth largest city in America, home to the energy industry, the space program, and the world's largest medical center. The competition for this recognition was fierce, and Helen won. Think about what these awards represent. In the 1980s and 1990s, immigrant women entrepreneurs were rare in any industry. In healthcare business leadership, they were almost non-existent. The boardrooms were dominated by men. The venture capital flowed to people who looked nothing like Helen Dichoso. She had none of the traditional advantages. No family money, no Ivy League connections, no established business networks. She had her nursing skills, her work ethic, her vision, and apparently, that was enough. The Joint Commission certification added another layer of credibility. The Joint Commission is the gold standard for healthcare quality. When they certify a staffing agency, they're telling hospitals that this company meets the most rigorous standards in the industry. Helen didn't just build a big company. She built a quality company, one that could withstand scrutiny from the toughest evaluators in healthcare. But here's what makes Helen's story even more remarkable. She wasn't building this empire alone. Alongside her was Dr. Carmelo Dichoso, her husband, a fellow Filipino immigrant who had carved out his own extraordinary path. Carmelo graduated from the University of Santo Tomas Medical School in the Philippines in 1966. He came to America and completed his residency at Baylor University. He became one of the first kidney specialists to emerge from Baylor College of Medicine's prestigious nephrology fellowship program. Think about that. A husband and wife, both immigrants from the Philippines, both conquering the highest levels of American medicine and business. She built one of the largest privately owned nursing agencies in Houston. He became a pioneering specialist at one of the most respected medical schools in the country. Together, they weren't just achieving the American dream, they were redefining it. And they were raising children who would carry that legacy even further. Because the Dichoso story doesn't end with Helen and Carmelo. Their son would grow up to become a physician himself, rising through the ranks to lead some of Houston's most important hospitals. The empire Helen built wasn't just a company, it was a dynasty. And that dynasty is still going strong today. Nearly 4 decades. That's how long Allied Health Services has been operating. In an industry where the Bureau of Labor Statistics says 65% of businesses fail within 10 years, Helen Dichoso's company has thrived for almost 38 years and counting. She founded it when Ronald Reagan was president. She's still running it today. The company remains headquartered in Houston at 2421 West Holcomb Boulevard, just minutes from the Texas Medical Center she's served since the beginning. It still provides registered nurses, licensed vocational nurses, certified nursing assistants, and surgical technicians to hospitals, clinics, and outpatient facilities across Greater Houston. The Joint Commission certification still hangs on the wall. The commitment to quality that Helen established in 1987 still defines every placement. But the company has also evolved. Allied Home Health now provides private duty care, bringing skilled nursing directly into patients' homes. Assurance Health Services expanded the family's healthcare footprint even further. What started as a single specialty staffing agency has grown into a network of healthcare businesses, all still family-owned and operated. Helen remains president of the company she built from nothing, and her son Daryl has taken the family legacy in new directions. Dr. Daryl DiCioso grew up watching his parents conquer American healthcare. His father, the pioneering nephrologist, his mother, the award-winning entrepreneur. It was practically inevitable that he would follow them into medicine. He graduated from the University of Houston and conducted research at the National Institutes of Health in Bethesda, Maryland. Then, like his father before him, he attended medical school at the University of Santo Tomas in the Philippines, maintaining the family connection to their homeland. Today, Daryl DiCioso holds one of the most powerful positions in Houston healthcare. He serves as Associate Vice President of Medical Operations and Hospital Medicine at Memorial Hermann, one of the largest health systems in Texas. He's the regional manager overseeing Memorial Hermann Sugar Land, Southwest, Katy, and Cypress hospitals. He led frontline COVID-19 response teams during the pandemic. He's been named Outstanding Male Physician, Memorial Hermann Sugar Land Physician of the Year, and received the award for excellence in quality and safety. 3 generations: nursing, medicine, business, hospital administration. The DiCioso family didn't just achieve success, they built a dynasty. But Helen's legacy extends beyond her own family. She represents something larger, a hidden class of Filipino nurse entrepreneurs that America has never fully acknowledged. Dr. Jennifer Nazareno's research at Brown University documented this phenomenon. Filipino nurses across California, New York, and Texas didn't just fill staffing shortages. They built businesses. They created what Nazareno calls an ethnic economy, where nurses shared resources and helped each other succeed. Helen DiCioso is part of this invisible empire of healthcare entrepreneurs who transformed their clinical expertise into business ownership. And that brings us to the woman herself, Helen DiCioso. Approximately 79 years old, still president of the company she founded in 1987. A graduate of the University of Pangasinan nursing program. An immigrant who arrived in America when Filipino nurses were flooding into the country to fill desperate shortages. A woman who looked at the chaos of hospital staffing and saw not just problems, but possibilities. She won Ernst & Young's Entrepreneur of the Year. She won the SBA Entrepreneurial Success Award. She won Women Business Owner of the Year. She built one of the largest privately owned nursing agencies in the world's largest medical center. She raised a son who now leads hospitals. Helen DiCioso is the Filipino nurse who built a healthcare empire in Texas, and her story is still being written. Helen DiCioso's story is one that should be told in business schools, nursing conferences, and Filipino communities around the world. Here is a woman who arrived in America with a nursing degree from a provincial university in the Philippines, worked the grueling night shifts in Houston's ICU wards, and then had the vision and courage to build something entirely her own. In 1987, she bet on herself. She walked away from the safety of a hospital salary and created Allied Health Services from scratch. She won contracts with some of the biggest hospitals in the world's largest medical center. She expanded from ICU staffing into every major nursing specialty. She earned recognition from Ernst & Young, the Small Business Administration, and the National Association of Women Business Owners. She built a company that has survived and thrived for nearly 4 decades. But perhaps her greatest achievement isn't measured in contracts or awards. It's measured in the family she raised alongside her husband, Dr. Carmelo DiCioso. Their son Daryl is now a leading physician administrator at one of Houston's major hospital systems. Their business remains family-owned and operated. The Dichoso name has become synonymous with healthcare excellence in Houston. Helen represents something larger than herself. She represents the thousands of Filipino nurses who came to America seeking opportunity and who saw, in the gaps and inefficiencies of the healthcare system, chances to build something new. She represents the hidden entrepreneurial class within the nursing profession. People who know how hospitals really work because they've lived it. Today, at approximately 79 years old, Helen Dichoso still serves as president of the company she founded. Her story is still being written. So which part of Helen's journey inspired you the most? Was it her courage to start a business as an immigrant woman? Her strategic vision to expand into multiple specialties? Or her ability to build a family dynasty of healthcare leaders? Let us know in the comments. And if you found this story as remarkable as we did, make sure to subscribe before the next one drops. Because there are more stories like this waiting to be told.